Welcome into the office, Mr. Walker.
Thank you.
So my name is Kira. I'm one of the
hmm
nurses here.
hmm
What we're going to do is you're going to get started with me. I'm going to get your medical history, your social history,
hmm
get it into our system. The
hmm
provider will see it.
hmm
And this is how we start to come up with your care plan and make sure we're best meeting your needs. That
Okay.
sound good?
hmm
So I do have a lot of questions. We'll
hmm
do a little bit of talking.
hmm
I'm going to be typing here on my computer just to insert the information you need.
hmm
Okay. Can you describe any current health conditions you're managing at this time?
High cholesterol, high blood pressure.
Um, are you seeing specialties such as cardiology following you regarding these conditions?
Not consistently.
Okay. You have though.
I have seen a cardiologist.
Well, let me stop there. Are you taking any medications for
I
it?
am taking meds for the high blood pressure. I'm taking lisinopril, 10 milligrams daily, and I'm also taking a statin one time daily as well.
Okay. You know which one?
Simvastatin.
Okay. And who prescribed those meds?
My primary care doctor.
Your last primary care. Okay. All right. Would you say that it's impacting your daily life or is it just pretty well managed?
Is pretty well managed.
Okay, good. Any other conditions that you want us to be aware of?
No,
Okay. Any history of any just severe illnesses or hospitalizations?
no.
Nothing that you still
I've never
on?
been hospitalized.
Okay. Okay. Um, do you have any significant health conditions that run in your families? Hypertension, diabetes, cancer?
Yes, yes, yes.
Right. Um,
I completed that form.
out of you did. Okay.
hmm
Let's see. Okay. Okay, I can see you have a history of diabetes, paternal side,
hmm
cancer, maternal side,
hmm
and then hypertension. It looks like your mom has.
hmm
Sound about right? That's what we have.
Sounds, yeah, that's what it is.
Okay. All right. Do you have any other medications you're taking for anything else in
No,
addition to? Okay.
I take vitamins.
Okay. Which vitamins? We like to insert the supplements.
Vitamin C.
Do you know the amount you're taking?
I take 500 milligrams per day. I take vitamin D for my nails and my hair
Good.
as well.
Awesome. Okay. And do you know how much of that you're taking?
I take 20 milligrams per day.
Vitamin D, 20 milligrams?
I don't know how many milligrams I take per day.
It's probably more like 1,000, 2,000,
Maybe
five
it's
thousand.
maybe it's 500.
And you know what you can do is anything you're not sure about,
hmm
you can either take a picture of it on your cell phone, show it to us
hmm
later, or just
hmm
make a note of it, show it to
Okay.
us later, so we
No
can make
problem.
sure we have what's correct in the
Sounds
supplement.
good.
All right. Okay. And how about like any herbal remedies or anything like that?
No, I'm not taking any herbal medications.
Okay.
You
And
mean like marijuana?
um, well, I was going to get to that question. Do you have any substance use?
No.
Okay. Do you have any history of smoking?
Nope.
Any
No history.
any alcohol use?
Uh, Not really, just a couple of times a week.
So tell me more. Are we talking like wine,
hmm
liquor,
hmm
beer,
hmm
all
Yes,
three?
yes, yes. Oh, some occasional wine, some occasional liquor, some occasional beer.
Okay. How many times would you say a week?
Let's see. Wife comes home from work once a day, 5 days a week, 5 days a week.
All
Yes,
right. So am I putting in accurate information?
that is very accurate.
Okay. So then you got to tell me how much liquor is it when you're
No,
drinking?
I'm maybe twice a week.
Okay.
Twice a week.
Is it beer, wine, and liquor? Or is it?
Maybe one time beer, other time wine, something like that. Depends.
Okay. All right. Are we talking like a glass of wine
Yeah,
or?
glass.
Okay. All right. So that's your alcohol use. You said no history of smoking, and then okay, so whatever substances. Okay. All right. And you already said no surgeries. Okay, so walk me through your typical day of eating. Trying to just get an
Um,
idea of your nutrition.
I eat basically 2 meals a day, breakfast or lunch, and then dinner. If I have breakfast,
Okay.
I skip lunch. If I have no breakfast, I tend to get something for lunch.
Okay. And that's just busy lifestyle that sometimes causes you to miss like the typical 3 meals.
Yeah, sometimes work is too busy in the morning, or sometimes if I eat too much breakfast, I'll get tired or something. So,
Okay. And do you have like any a special diet or any dietary practices you want us to be aware of?
no.
So just regular diet.
hmm
Okay. What's your current level of activity?
Um, I don't work out frequently, but sometimes I'll go for walks, ride a bike.
Would you say this is like a few times a week or
No,
a
honestly,
month?
probably 3 times a month.
2 times a month? Okay. Okay. How do you feel physically overall? Do you have any body changes concerning you? Anything with your health overall that's got you concerned lately?
I had some pains in my calf, in my
Okay.
toes
Okay.
recently. It's weird,
How did
but
you address that? Have you
I
seen?
stretched it out, rested it for a day, and it went away.
Okay. Was that sudden?
I was running, sort of straining something maybe.
Okay. And how is that doing now?
It's better.
So did you treat with like painkillers, ice
I
or
took some
heat,
ibuprofen.
ibuprofen? Did you apply anything, ice or heat?
Yeah, a glass of wine. Oh, heating pad too.
You had, and I'm
hmm
assuming you rested it. Okay.
Rest.
And today it
It feels great today.
feels great.
hmm
So improved. Okay. Any other concerns about your health or your body?
Nope, no other concerns.
Okay. So no like sudden loss of appetite, weight, fatigue, anything like that?
No.
Okay. All right. How have you been feeling mentally, like your emotional health?
I feel fine. I'm blessed. Every day is
I love to hear that.
yeah, something to be thankful for.
Good.
Mhm.
Love to hear. No history of mental illness.
No history of mental illness, no.
Okay. Or any behavioral health issues?
I'm married, so not me, my wife probably, but no, me.
Okay. Have you ever taken any medications to support your mental health?
Um, I've occasional taking some Zoloft, take the edge off a little bit.
Zoloft is one of the ones we would take
Oh yeah, that's
over
more
time,
maintenance, right? Yeah, no. So I've taken
like maybe Xanax, Ativan.
yeah, the generic Xanax
Okay. All right. How often do you take that?
as needed.
When's the last time you took it?
20 minutes ago.
Did
I
you?
get nervous coming to the doctor's office.
A lot of people do.
Mhm.
A lot of people do. Okay. Okay, we will note that. So you do
hmm
take Xanax currently as needed.
Yes.
Okay. So today. Great. As far as your health history, before we move on, did you have anything I did not ask that you wanted me to note?
No, nothing else.
Okay. All right. So you mentioned your wife, as far as your support system, you're
hmm
married, do you have children?
Yes.
How many children do you have?
True.
Besides your family, do you have any other support system?
No.
Okay. And is this who you live with? Your
Yes.
family? Okay. Do you feel like your home environment inside and out is safe?
Yes.
Okay. You have there's no barriers in the home, like you got running water, electricity, heat, all those things.
Yeah, we have running water, we have electricity, all
Heat.
that, heat, everything.
Okay. So no barriers in there.
No
Okay.
barriers.
Your financial situation currently, do you feel like you have access to healthcare, the resources you need, medications?
Yeah, I have good insurance and
What insurance do you have?
Blue Cross and Blue Shield.
Okay. And you feel like you have access to all you need, you and your
Yes.
family. Okay. Okay. Um, okay. Are there any cultural
No.
practices that you want us
No
to be
practice.
aware of? No beliefs? How about spiritual?
Mm, Nothing that's going to impact healthcare.
Okay. Because more so we're looking for, is there anything that's going to affect like your understanding of your care or how you may
No.
view, what you're experiencing, how we treat
I
it?
understand the question. Yeah.
Okay.
Mhm.
All right. Okay. So moving along here. What's your highest level of education?
High school, um, Plum. Well, GED.
Okay. Do you feel like anything about your level of education is going to affect how you understand or view what you're experiencing with your health or the
No.
care that you receive?
Nope. I understand
Okay.
everything.
Okay. What's your current occupation?
Self-employed.
Um, what you're doing currently, do you feel like it's impacting like your physical or mental health?
No. As long as it's cold, I work out in the cold, but you get over it.
And really quick, I'm sorry, just to circle back to mental health, I did forget to ask, have you ever gotten any services like therapy support, like anything outside of what we mentioned about medications for
No.
mental health?
No.
No? Okay. Are you interested in receiving any?
No.
Okay.
It's not needed. Everything's perfect.
Okay. And do you have like any recent like losses, transitions, changes going on in your life that were like major, kind of shifted things around for you that you want us to be aware of? Like any major stressors?
Bar at the corner closed. Pretty upset about that, but no, outside of that,
Mhm. You're a funny guy, I see. I enjoy that.
I try to keep it light.
I enjoy that. So ultimately, you feel safe at home?
Yes.
Okay, great. Okay, what pharmacy do you currently use?
Walgreens.
Okay, is that the Walgreens near you on Ridge Avenue?
Yes.
Okay, put that in. And let me look and make sure we have records from your last primary care. Yes, we have those in file. Any recent travel outside of the country?
No.
Okay, so you haven't been around anyone majorly ill or seemingly sick, sweating,
Nope.
feverish, coughing.
Nope.
Okay. Is there anything I didn't ask or mention that you would like us to know?
You
You
asked a lot
got
of
them.
questions. There's nothing else there is to know. You know everything about me.
Okay. All right. All right. So we've got all your information in the system. So our provider will have this to get started, and that's who you'll be seeing shortly. Okay.
Okay.
All right. All right. Be back with you.
Okay.
All right.